Hello everyone, today we will learn a special acupuncture operation method, three-edged needle therapy. First of all, let's understand what is three-edged needle. The three-edged needle, known as sharp needle in ancient times, has a thin and round handle, a triangular body, and a sharp tip. So, how does the three-edged needle treat disease? It refers to a method of pricking certain areas or acupoints with a three-edged needle, causing bleeding or squeezing out a small amount of liquid, or pricking out subcutaneous fibrous tissue to treat certain disease. Okay, let us learn the specific needle operation method. Before the operation of the three-edged needle, the needle should be outer cleavage or soaked in alcohol for 30 minutes. Also sterilize the area with 2% tincture of iodine, and then with 75% alcohol-soaked cotton balls. Doctors should wash their hands with soapy water, then wipe hands with alcohol cotton balls. Finally, the doctor could wear disposable gloves in order to avoid cross-infection, which is caused by inadequate disinfection. Disposable needles are often used in clinic now. Second, let us talk about how to hold the needle. Generally, you could hold the needle with your right hand and use your thumb and index finger to pinch the lower part of the needle handle. The middle finger palm is close to the side of the needle body and exposing the needle tip 3 to 5 mm. The operation is generally divided into 4 types, namely spot pricking, scattered pricking, blood vessel pricking, piercing needling. Now let's talk about them one by one. Spot pricking means we could prick the area with the three-edged needle swiftly to a depth of 3 to 5 mm with the right hand, and withdraw the needle immediately. After that, sequence and press around the pinprick to discharge a few drops of blood, and then compress the skin opening with a dry, sterilized cotton ball to stop bleeding. This method is mainly used on the 4 extremity points, such as 十宣, the 12 Jing Well points, and the ear apex. Scattered pricking indicates that we should prick the areas from the outside to the center, and in a circular manner. And one area may be pricked in more than 10 to 20 spots. This method is used to prick around the affected area. It is mainly used to treat local blood stasis, hematomas, edema, and starpentenia. Next one, we call it blood vessel pricking. Tie off the limb with a ribbon at the proximate part of the vessel to be pricked and disinfect the area carefully. Prick the blood vessel with the three-edged needle swiftly to cause bleeding. Then compress the area with a dry, sterilized cotton ball to stop bleeding. This method may lead to amount of bleeding, and it can bleed dozens or even hundreds of milliliters at a time. Therefore, this method needs to be used with caution, and it must be based on mastering the patient's physique and disease nature. It is mainly used to treat vomiting, diarrhea, and heat stroke at points 尾中 and 取则. The last method, piercing needling. Press or pinch the skin around the point with the left hand to hold the skin firmly in place. Prick the epidermis up to 1 to 2 mm in depth with a thick needle or a specialized needle for piercing. Position the needle in an oblique direction and hook the skin with the tip of the needle to cause bleeding or mucus discharge. The needle may be submerged deeper to about 5 mm and then used to hook and sever some fibrous tissue under the skin with the needle tip. After piercing, the pricked area needs to be disinfected and covered with sterile dressing. This technique is mainly used to treat insomnia, stomachache, cervical spondylopathy, and others. For the indications in clinic, we usually use 3-AG needle to treat 4 types of disease: excess syndrome, heat conditions, blood stasis, and pain. And the therapy is often used in the treatment of emergencies, such as coma, high fever, tense pattern of stroke, and so on. Of course, there are some things that we need to pay attention when operating the 3-AG needle. So question here, what should we pay attention? Firstly, the 3-AG needling may induce a strong reaction. Thus, an adequate explanation to the recipient is necessary before starting the technique in order to disperse any virus of the patient. The pricking should be done superficially, quickly, and accurately. Be sure not to injure the arteries and other tissues. And we need to control the amount of bleeding according to the different disease conditions. And strict disinfection should be carried out to prevent infection. Besides of this method should not be used in patients with a weak constitution, anemia, hypertension, pregnant women, postpartum, infants, and patients with hemorrhagic disease. Thanks for listening.